about our values and standards is so important because it helps us define our culture. And the culture is important because in a place like Swedish, we want our culture to be all about people and serving people well and respecting human dignity and giving the very best to every single person that walks in our doors.
It's important that we all recognize that patients need more than just treatment, therapy, medications, that they need the personal touch.
Looks really good.
Yeah, she's doing great.
I had a couple walking down the hall. They needed to go to the 701 building, not the 501. So I actually stopped, took them to the 701 building, took them out. Of course, I was on my way to lunch, but that's all right.
When you're cleaning the room, it's the same thing like you're cleaning your house. How do you like to bring your family here or friends or your mom in the hospital, in that spot, in that room, if it's dirty? Of course not. Make sure that we clean the room really good for the patients.
Something that's really important to me is to represent not only my department and my trade of work, but Swedish in general. One way I like to do that is to always let them know who I am, why I'm here to help them, and how I'm going to help them. I love to thank them for coming to Swedish. I know these days it's a choice. Even if it wasn't a choice, just thank them for their time here and for allowing us to help them through their time of need.
I really want to make them feel like the time that I have with them at the bedside, that they're my only priority for that day. So I like to sit down with the patient. I like to kind of be eye level with them, take what time they need to understand their disease process for that day, their clinical course for that day, our direction, our goals, and then answer any questions or concerns on top of my recommendations for the plan for that day.
The IT department contributes to patient care through the fact that we have to ensure that the computers are always working so that the nurses can chart, and that's very important in providing great care for a patient.
We had a rapid response not too long ago. The daughter was present and she was really scared and anxious, didn't know what was happening with her dad, so we just had some other nurses there and we were just letting her know what we were doing and what to expect, just keeping her involved.
As a chaplain, patient and family-centered care is really the foundation of what we do. I get to sit bedside with patients every day. There's careful attention paid to the story of every patient, and then of course sensitivity to their faith tradition and background.
Not too long ago there was a 1-year-old baby that was having her first birthday in the hospital. She won't remember it, but the mom will. And so we got balloons together and a birthday cake. We went and got a cupcake for her to eat. And we all went up and sang happy birthday to her. And just the look on the mom's face, I felt like I was $1 million to that woman because I gave her what she couldn't give her daughter that day. Sorry, it just was everything. This little girl, she's so sick, and even though she didn't know what was going on, her family was so appreciative.
It takes a team because you need all the components to work together at one time. Again, the doctor has their job, the nurses have their job, the physical therapists have their job, the tech. Everyone's very important and needed to achieve the best outcome for that patient and to give that patient the best care.
Teamwork is a huge part of my job every day because I think as a trauma patient, you're really scared when you first come in. And so to help alleviate all the fear and anxiety and just the tragedy that they've all been through, I think it's huge that we work together as a team and we communicate really well.
In the lab, our laboratory scientists make sure that the patient testing is done in a timely manner, which is very important when it comes to the patients. In the specimen center, which is where I work, we go up to the floors and we draw the patients. So we want to make sure that the patient and their family members are comfortable with what we're doing. And so we do a lot of focus and we make sure that they understand what's going on because sometimes it can be a little confusing.
I like to represent the hospital in a professional manner, so every time I speak in classes and represent our program, I make sure that it is an honest and valued manner.
We have a culture that values people, a culture that puts people first, that patient-focused care. It's going to drive everything we do. It's going to drive the quality of the care we deliver at every level.
It's important that every single person recognize that it is that handshake, that eye contact, that smile, that caring glance, that 30 seconds of listening, getting a blanket, anything that you can do to make the experience a more comfortable one that reduces the anxiety of the patient, and one that makes them feel like they are in an environment where people care.
It's important that they know that I care, that we care, and that I'm here to do whatever they need.